morning. Here we are. I'm Dr. Respaldo. We are in Archamps in Vivacy office. We're going to show you how we manage to inject male with the stillage range. So we have Dan. How old are you, Dan?
56.
56. You look younger than 56,
Thank
honestly. So Dan complained about his nose, who is drooping a bit. You know, we are losing bones on the nasal spine and a little bit on the radix, which is the nasofrontal angle. So goal number one will be to lift the tip, to project the tip by injecting some stylage on the nasolabial angle. For that, we're going to use stylage XL with lidocaine, and could be enough if the tip is lifted enough. So then we can also use a drop of stylage XL on the nasofrontal angle. The second idea would be to make the lip more symmetrical. You see we have an asymmetry, and then it's okay to make it a little bit bigger, the lips, okay?
Yes.
Perfect. So we're going to use the new stylage Lips Plus for that area. I suggest then to Dan that the chin also, it is a bit retruded, so we're going to use stylage double XL on the chin with one injection point, and also to define his jawline to make it more obvious and more masculine by injecting on the gonion, on the angle of the mandible. Last but not least, when we age, there is a sagging on the midface that create what we call the tear trough, the hollow eyes. So we're going to inject double XL stylage on the midface to reduce the distance between the eyelashes to the midface projection point by creating a convexity like that. And then we can also use stylage L to make this more round and convex on the malar bone. At the end, would be a good idea to shave a little bit that nasolabial angle with stylage M. Sometimes I like to also use a bit of stylage L on the lateral part of the eyebrows. Okay, ready?
Ready.
Okay. For any kind of injection, of course, you have to wear gloves to protect your skin and the skin of the patient. We'll always clean the face before injecting with an antiseptic. So we're going to start on the nose injection right here. So as I'm cleaning all the face, I remove all kind of risk. So for male, normally we don't have makeup, or if there is makeup, you have to remove it before you use the antiseptic. Voila. And before I will do any injection before I will use the antiseptic. Right. Alors. So product we're going to use is stylage XL with lidocaine. Alors Dan, you ready?
I'm ready.
Okay, we start. So the first injection point is right at the nasolabial angle, yes. Okay. So we inject very slow. Ça va?
Ready.
Mm-hmm. Okay, so we use all the length of the needle down to the nasal spine. If you don't know where you are, you have to touch the bone, but it's painful. Normally, all the length of the needle is enough. And you see how slow I'm going. You see the flow on the piston. Because you have time to the lidocaine to act. And this is how you can inject softly and not so painful. Because a lot of my colleagues, they say, wow, this is painful. But you see, I mean, Danny is a great guy. Doesn't complain, but yeah, if you go slow, it's easier. So we're already injected 0.5 ml. Voila. Now I need to do a little trick. So this is a trick to inject on the columella, which is step 2 of this technique, which I call it the Eiffel Tower nose lift. The first is a footage on the nasal spine. The second injection point is the same entry point, but it's on the columella. And because we bend the needle, we can go in between the two alar cartilages. Voilà. And that supports the tip and lift and project the tip. You see, it's not that painful. And with the same entry point, we can create a good shape and a good support on the tip. Well, and the step 3 would be to go on the tip from the same entry point. So we don't need to over inject that area. And I don't like to inject on the tip because this is a triangle with a soft triangle with a light projection, and we don't want to change that. We already injected 0.8 ml on the nasal spine, right? And now we're going to finish, so I'm going to change the needle. We're going to finish on the nasal bridge. On the nasal bridge, I come on the left side as I am right-handed. I pinch the skin here and you inject right down to the bone medially. So all those injections are safe because the arteries, they run laterally to the nose and then give some branches, but never on the midline. So that's why I like those injections, this Eiffel Tower technique, injecting really medially. Okay, and I try to do everything with one syringe. Of course, we can use more, but for the budget, if you can do with one syringe all the procedure, it's good. Okay, and this is 0.2 on the nasal spine, and roughly we have something straight. It's important not to over inject the nose and especially the tip, as on the male we don't want something pointy like this. On a female I would inject a little bit more. Injecting medially, you don't have the product that spread laterally on the dorsum and here. So also because of the rheology of the product, Stylage XL is very cohesive, so it stays as a bolus, or the shape remains the same. Voila. So Dan just said that he is numb on this area, so that's why I started with the nose injection on the nasal spine, and now I'm using Stylage Lips Plus on the lips. So thanks to the lidocaine on the Stylage XL, I have this area a little bit numb, so it's easier to inject. Because if you start with the lips, and then it's painful, more painful. So for the lips, I'm going to follow the edge of the lips, the contour, and by the same entry point, I will do a little bit of volume. Alors, we start laterally here. So it's an anterior grade injection, anterior grade because the lidocaine is working at the same time I'm injecting. So it's less painful for the patient. Ouvrez un tout petit peu la bouche, mais très léger. Voilà, perfect. So that's the contour, and then I'm doing a little bit of volume on the red mucosa. Okay. It's very pleasant gel, easy to inject with a 30 gauge needle. Voilà. Okay. We can also do the Cupid bow. Normally it's very painful, but thanks to the injection that we did on the nasal spine first, we get this numbness medially. Voila. Okay. And compared to the other gel, like Lips or M or S, this gel gives more volume for the same quantity. So I go on the other side. Okay, so we have done the right side of the upper lip, so now we do the other side. following the contour and then injecting a little bit oblique on the red lip. So we are far away from the danger of the labial artery, because this labial artery is inside the lips at the junction of the red mucosa, the wet part, and the dry part. So I'm going to show you at the end of the injection. Okay, so the arteries are here. Sometimes we can see them. It's here. So we are really far from the arteries. So as the lips for male and the mouth is a bit bigger, so we need a second syringe for the lower lip to give him a good volume. So the same concept, anterograde injection to use the lidocaine to numb the area, following the lip contour to create a nice shape and definition at the junction of the red lip and the white lip, and then injecting a little bit oblique, like 30 degrees, into the mucosa. And roughly we are close to the muscle or intramuscular, but not perpendicular, as if you're perpendicular, you're too close to the arteries inside. But this way, following the edge of the lips and the contour, I have absolutely no risk, ouvre un peu la bouche, to have a dangerous injection in the artery. Okay, ça c'est bien. Voilà. So I start the injection and then I stop, and I start a little bit before, because then here I have lidocaine where I injected. It's also a trick. And the anterograde injection is really interesting because you numb the area before you inject. Because retrograde you inject and then the lidocaine act when you're outside the lips. Okay? Mettez un peu la tête comme ça. Voilà. So maybe we need a little bit of support here. Yes, to avert a little bit the lower part, the center part of the lower lip, I use this little trick. I put a Q-tips here and to block the skin, and then I inject really at the border of the lip, like that. It's like creating a little balcony on top of the skin, and that creates a little shadow. Voila. And then you have this elegant reversion of the upper lip. Voila. C'est bon. So you see, I don't do a lot of massage, because if you do this fanning and anterograde technique, you don't need to massage that much. I just, especially on the lips, I like to feel the shape and to mold it, to mold the gel, just to control there is no nodules or papules, and it's homogeneous. Voila. Step 3 is to project the chin. So this is very simple. You look where is the midline. Ouvre un tout petit peu la bouche. Voilà, you see in between the two incisives, right here. I ferme la bouche. Put my finger there, that's the midline, and then I inject here immediately, 1 centimeter from the bone. So if you want to create a square chin, you use 2 entry points, but with also 1 entry point, I like to do like a pyramid shape. So from the same entry point, I inject the stylage XXL, sorry, and that's exactly the shape of the bone of the menton, right? And of course, for a male, we project it a little bit more than a female, because this is more Masculin. Voilà, ok. Tac. So that was 0.7 ml. And then you can shape your gel, mold your gel like this. Baissez un peu la tête. Voilà. Ok. 0.7, and I like to enlarge a little bit the chin by injecting a little bit more lateral here and here. So that creates a more effective shape on the chin. Yeah, so that stays on the chin more than a year and a half, on the nose a year and a half, lips a year, let's say a year, okay? Voila. And you see on the profile, maybe you can show on this one. See the shape of the nose. We can do a little bit more, but that will be too feminine if I inject here. Voilà, c'est bien. Okay. So this has a strong jawline, even if the lips are like very a bit glossy. It's very masculine, the nose and the chin. Now we're gonna use double XL on the gonion. I will start with the left side. So to define the jawline, especially the angle of the mandible, we call it the gonion. We have to use Steel Edge Double XL. It's the strongest product, and we have more cohesivity on the Steel Edge range. So the trick is to put the two fingers around the gonion, so you feel the bone, and then you go right on the gonion. Now I feel the bone. Ça va? C'est pas trop douloureux?
No, no.
Not so painful? Okay.
No, it's not.
When you are on the gonion, not on the masseter, but really at the bone, there you start to inject. You create a pyramid to project laterally and vertically the gonion. There is no risk here because the parotid gland is higher. The facial artery is really at 6 centimeters from here in the front of the masseter, and the duct of the parotid gland is really higher at 4 centimeters. Okay, of course the carotid artery is that deep, 5 centimeters. So when you inject the gonion, then you can also use the same entry point and create a bit more projection on the horizontal branch of the mandible, right? And same entry point, I like to use a vertical injection. Voilà, like. And you see I do all this with a needle. Of course you can do with a cannula, but I like to create that shape, so you don't need a long cannula to do that. Okay. So you see the projection of this. I want to feather a little bit the end of my triangle horizontally and vertically. Voila, not bad. You can compare this side to the other side. Voila. Okay, with just one syringe, 1 ml of XL. Now we go for the other side. Okay, so on the other side, on the right side, you see there is a danger here. It's an angioma. So of course we're gonna avoid that angioma. Again, you put your fingers around the gonion and 0.5 centimeter from the angle you go on the bone, right? And then you inject to create a pyramid, a bolus or a pyramid. So it's slow injection, so it's not that painful, and you see what is going on with your product, right? You have to be careful with this angiomas. I'm going to use a deep injection along the mandible. Here I'm subdermal, I'm really deep, probably into the fat here. And then I use the same entry point, and I use a vertical injection to create the horizontal branch, a new horizontal branch more defined. Voilà. C'est bien. Okay, and you see the shadow, now we have more shadow thanks to this convexity and this projection. Okay, alors de face, ouais, c'est bien. So now we have a more masculine jawline and chin. So for the mid-face, it's very important to know where you inject and what you want to create. I want to create a convexity to reduce the distance between the eyelashes to the border of the orbit. And for that, I'm going to inject in this area here. The danger or the facial artery here, which comes from the masseter, goes into the nasolabial fold, and then the ungulis artery here give a branch to the nose, the nostril, and here on the lips. We don't have big dangers right here in the middle. That goes with a collateral sometime with the supratrochlear artery and supraorbital, and that's where the danger is. So this is a no-go zone. The other concern is the infraorbital nerve. Infraorbital nerve is, regardez droit la caméra, okay. From the supraorbital nerve here you have a notch, and then you make a straight line down to the mental, and 1 centimeter from the orbital rim, right here you have the infraorbital nerve. So the nerve is not a big problem, it's the artery close to the nerve. So I create a simple concept of the safe triangle. This is published in the Journal of Cosmetic Dermatology and Laser Therapy. So you draw the upper part of the triangle, which is the orbit. And of course, we never inject higher than the orbit. Then you draw a second line from the inner canthus down to the corner of the mouth, which is here. And then the last one is from the lateral canthus to the corner of the mouth. And this is a safe triangle where you can inject with no big trunk or big vessels or big nerves. And the last trick, you draw a line from the nostril to the tragus, like this. And the injection should be higher than this part, otherwise you make this worse. So you don't inject here, you inject in this rectangle. Okay. Alors, so we're going to keep the drawings just to show you where we are. And here we are with the Stylage XXL. Just a trick where you don't know where to go. You put your finger on the corner of the mouth and the head of the finger on the lateral canthus. You go straight on the middle, and this 45 degrees, and you go down to the bone, and this is very safe, right? Descends un peu la tête. Voilà. Ask him to just put his head a little bit down because it's very high for me. So you have to be comfortable when you inject. So for a demonstration, I inject vertically like this. Normally in my office, people are a little bit more laying down. Ça fait mal là? Pain?
No, it's okay.
It's okay. So what I'm doing is I'm creating a bolus. So the difference between male and female, on male, the mid-face has to be slightly, very slightly convex, which is almost flat, not concave but flat. On female, I like to create really a convexity, and this a bit higher. Voilà, ça c'est pas mal. And if you turn the head, you see the convexity here instead of the concavity here. Voilà, it's very visible. So we created this projection. Well, if you compare that side, so that could be enough, but if you see I have a little bit of indentation and I want to have a little bit more convexity on the lateral side, I will use L, still age L, not double XL or XL, because I don't want projection or too much convexity. So that's why I'm going to use this L. So right there I'm down to the bone again, the malar area, malar bone. I create a bolus, and you see I'm safe away from those facial artery and collaterals. Of course, it's never 100% safe. You have to be careful to know where you are. Here is 0.5 and another 0.5 here, just to recreate a little bit of contouring. A bolus here of 0.3, correct. And the last one a little bit higher right here. Okay, and we can also use that gel to smooth this area here. So we clean the drawings just to show you the final result on this side. Of course, on real patient I don't draw, but it means that every time I inject, every time I do a procedure, I know exactly where are the arteries, the nerves, the bone, and where are the safe zone and the danger zone. Also, you have to understand that you don't inject a point, you inject a shape, you create a shape. And if we compare, regardez la caméra, that side, you see now it's convex and slightly convex on the lateral part compared to here, which is concave and flat and concave again. Voilà. To finish nicely this contouring, we're going to use stylage M on the nasolabial fold. So this is a very simple technique. It's the oldest one. I like to inject really subdermally. It's safe because the artery is 0.5 centimeter deeper. I like to use a needle. I know some people are scared and they use a cannula, but if you're really subdermal, or sometimes it can be even intradermal, like you see the blinching of the needle, it's very safe. Voila. So I'm doing a fanning technique to create a good network, a good shape. Voila. And sometimes I like to cross my injections a little bit more superficial. Right here. Parfait. Okay, so that was 0.7 ml for this nasolabial fold. I still have 0.3, so I'm going to use this 0.3 on the corner of the eyes. I put the finger or a pen right here. This is the orbit. I'm here. So I'm going to start 1 centimeter from the orbit right here to blend this area. Voila. And that's the treatment of the lateral side of the tear trough. Okay. And sometimes, so the orbit is here. I come there and I inject deep under the orbicularis. Right. You see we got this indentation here, and we smooth this indentation with just 0.3 ml of stylage M. Okay, and now again we can compare this side. Regardez la caméra, voilà. This side, smooth with no indentation, seamless transition from the orbit to the midface, to the lips and the jawline. And that side with the indentation, darkness, shadow, and a lot of break on the face. Voilà. eyebrows, I like to lift a little bit the tail of the eyebrows. So for that we have two techniques. The one is to inject on the temporal area, but his temple is really convex, he doesn't need that. The other trick is to inject a little bit of stylage S on the tail of the eyebrows, really here at the tail. So the trick is to draw a line from the corner of the nose and the lateral canthus, like this, and to draw the orbit. So that creates this shape, and that's what I want to recreate with the gel. And more you do an arrow, an acute arrow, more you have slanting eyes and the higher eyebrows. So for male, I will go softly. So you can use a cannula, but with the needle it's enough. You go anterograde and retrograde sometime, and you create this triangle, this shape, 0.2. Voilà, c'est bien. And so I end up here, so I use another entry point here, and I create a second shape with 0.3. So if we compare that eye, regardez la caméra, to that one, this one is flat and this one is a little bit up. Voila. So this is playing with light and shadow, creating the illusion that the eyebrow is higher. It's just because we create some shadow under this shape. Okay, so we are on the left side for Dan. Remember this safe triangle: inner canthus, corner of the mouth, lateral canthus, corner of the mouth, orbit. Put your finger from the corner of the mouth to the corner of the eyes, and 1 centimeter from the orbit you go down to the bone on a deep malar fat pad, and you don't need to touch the bone. So the infraorbital nerve is really medial 1 centimeter from my entry point. Even if the needle is that long, 1 centimeter, we know we are away from the infraorbital nerve. By the way, if you touch the nerve, you feel it, you stop. Okay. Sometimes there are questions. Okay, I have to give this shape, really nice shape, like a convexity. There is the question about aspiration. Honestly, if you aspirate, you have to aspirate all the time. And in my hands, I don't feel this is a safe maneuver. But if you feel comfortable by aspirating, why not? You see the shape now is really nice, just with 0.5 ml of stylage XXL. Now we go for the stylage L. I have an indentation here, and this is just to create a dome, a little bit of a bolus, to smooth the lower part of the malar area, like here. So I have a little bit of too much shape, so and then I want to make this projection laterally a little bit more obvious. Bolus 1.2, then I do 2 bolus of 0.1, like this. And this is to finish the lateral side of the malar area. Turn your face, then voila. You see how nice is this stylage L. Voila. Okay. The nasolabial fold. We will do the nasolabial fold with the stylage M. Okay, so is it painful?
No, it's fine.
Yeah. When I speed a little bit, this is how I do it in my office. Normally it's a little bit slightly more painful. Voilà. So vertical fanning and then crisscross injection, a little bit more superficial. Intradermal. That's a technique I learned in the 90s, early 90s, when we were doing collagen or other gel. This is very effective and safe because the artery is really deeper than where we inject. And again, we have 0.3, so this 0.3, we're going to use it laterally here to correct the indentation at the lateral side of the orbit, the tear trough laterally. So the gel will never be visible, that's why I can use also M. You can use S, but M will be more effective in this area. And then you can also mold a little bit the product. So that lidocaine will numb a little bit your orbicularis muscle then, and then for accommodation for 1 or 2 hours will be a little bit unpleasant. Voilà. And last injection is here. So remember, put the finger from the nostril to the corner of the eyes and the end of the eyebrow. Right, and that creates the shadow and the convexity. And a little bit more here. Voila. And you have to stop, remember, the supraorbital nerve here. Voila. Okay, so we finished with Dan. You see we don't have bruises or bleeding or a lot of swelling. We have done 1 ml of Stylage XL on nasal spine, and so 0.8 on the nasal spine and 0.2 on the nasofrontal angle. And we add 0.2 ml of Stylage S on the supratip here. And you see the delicate angle, and the nose is almost straight now. Then we use 1 ml of Stylage Lips Plus on the upper lip and 1 ml on the lower lip of Stylage Lips Plus. 1 ml of XXL on the chin and 1 ml on the gonion per side. 1 and 2 to define this jawline. You see how the jawline looks longer and stronger because of 1 ml here and 1 ml here. And that put a tension on the horizontal branch of the mandible. Then we use double XL, half a cc per side on the mid-face. Stylage L, 1 ml on the malar area per side. We use 0.7 ml of Stylage M per nasolabial fold and 0.3 on the corner of the eyes to correct the ends of the tear trough. And we use 0.3 ml, sorry, of Stylage S per tail of the eyebrows. Voilà. So, maintenant le verdict. So, Dan, have a look. What do you think? Right. And you see, you don't see the profile, but the nose is really straight. Voilà. And everything, now you can also socialize. It's not obvious. It's not like, wow, you have done something.
And no, we do have very strong light at the moment. So.
Yes. So the final result will be in a month. I recommend you not to do a lot of sport today. Tomorrow you can. You can have a shower. You can do on the sun. It's not a problem. Okay.
Okay.
And we control after a month. Okay.
Perfect.